On behalf of the Area Agency on Aging of Pasco Pinellas, I welcome you to Aging on the Suncoast. The Medicare Open enrollment period is a critical time for Medicare beneficiaries to review their coverage. To assist in this process, free, confidential, and objective counseling is available to Medicare beneficiaries, their caregivers, and family members through the SHINE program. For over 21 years, the Department of Elder Affairs has offered the SHINE program with the help of volunteer counselors who provide essential counseling service, empowering Florida's older and disabled citizens to understand and to maximize their health care benefits. On today's program, we have two guests to tell us more about SHINE and Medicare. Janet Mills is the SHINE Area Coordinator for Pasco and Pinellas counties, and Charles Frankel is the local area coordinator. Welcome to Aging on the Suncoast. I thank you for coming back again this year as we start the open enrollment period. It's an important time to hear from you and to learn what the SHINE program has to offer, to share that with our audience. Janet, if you can expand on what I said about the SHINE program to give us a brief overview of what it is.
It is an acronym, Serving Health Insurance Needs of Elders, but we do serve those who have Medicare, who are 18 and over by virtue of disability. They are called early Medicares, and it is a free and unbiased program to help people understand their Medicare options, any types of problems that they're having with their Medicare. We really encounter a broad spectrum of questions, but we're there to help, and it is free and unbiased counseling.
And it's a nationwide program, isn't it?
That
is federally funded. It's interesting when I pick up the Medicare and You book that CMS mails out every year to Medicare beneficiaries. The telephone number that is listed there for assistance is actually the local SHINE program's telephone number. They're going to reach you all if they call that number.
That is for Florida, right? Or our area of Florida, right?
So you all are a very important local resource that can reach out to residents in our community to provide assistance. And Charles, give us a brief overview of the type of assistance that a SHINE counselor can provide.
Okay, well, especially this time of year coming up, one of the most important things we do, excuse me, is help people
with the open enrollment.
Open enrollment, review the plans they have, see if that's the proper one for them to continue through the next year. People who are newly enrolling into Medicare, how did they enroll sometimes? What are their options once they have enrolled? Other things we do once they're enrolled in Medicare, there's some problems they may have, whether it's financial. There's some aid we can help them with, whether it's with medications or others. Sometimes there are billing problems or appeals. So there's several things we can do to help them.
And it's a year-round program. We think of it intensely during open enrollment period, but you all are available all year round during business hours to provide assistance. How do they contact? How does someone in our audience make contact if they are wanting assistance?
Well, you were referring to the phone line, which is 1-800-963-5337, and that will bring you in to our area agency on aging, which is Pasco and Pinellas County. They can go to the floridashine.org website and make contact that way, and those come directly to our PSA area again, which is Pasco and Pinellas. And there are also outreach sites which can be looked up on the floridashine.org website, or they can call the helpline and they will tell them where an outreach site for face-to-face counseling is in their area.
Excellent, excellent. And we will be running the telephone number and also the website, so if our audience, people in our audience want to write that down, it will be running. Charles, when someone places the call to the helpline, what happens from that point? There's not SHINE counselors immediately available to talk to them,
No, they will be referred to a counselor. So a counselor ordinarily will give a call back to the person. And most of the time we can conduct whatever information we need to give over the telephone. As Jan said, there are some counseling sites if more face-to-face is required, or someone could come into the agency, but that has to be arranged with an individual counselor first.
What is some of the information that a person should have prepared before they talk with a counselor that's generally helpful?
Well, that's as a counselor, the thing we really need to do is understand what their issue is. And if it's just If it's looking for help of some sort, sometimes you would need their Medicare number, address, phone number, date of birth, that type of information. If they're looking for a new plan, one of the most important things to have is their drug list.
Okay.
So we can look up and see which plans best cover their drugs. And if they're looking at some of the Advantage plans, then contact their providers to see which plans they take so we can help narrow it down.
Okay. And we're going to talk about that in more detail because the open enrollment period is now. And
October 15th through December 7th, yes.
Okay.
And for an effective date of January 1st. So the time is nigh.
for people to look at their plans. What happens during an open enrollment period? What types of decisions need to be made during this period?
They need to know that their providers will be continuing on with the plan that they're currently on, if they like their plan. If they don't like their plan, then like Charles said, you can contact the providers and find out what other plans they will be contracted with. They need to check and make sure that all of their drugs are on the formulary of the drug plan that is either part of a Medicare Advantage plan or a standalone plan.
And we're talking about, during open enrollment period, a person who has a Medicare supplement or a Medigap, they don't need to be doing anything during this period other than looking at their Part D, correct? Or
well, they might want to reevaluate their whole situation.
Okay.
Every year, the supplements are most of them pay the other 20% that original Medicare doesn't pay, but they do tend to get a little more expensive every year because they're age related. And then you have a standalone Part D, which also has a separate premium. So you might want to look at the financial and coverage aspect of those also.
Yeah, but basically this is the time where whatever plan you have, you can reevaluate and decide if you want a different plan. If you have an Advantage plan, you can go back to original Medicare, go to an Advantage plan, change plans, change drug plans.
Okay.
So if you've been unhappy and want to make a change, this is the time to do it. But the other important thing is whatever plan you have is probably going to have changes made. So
you can't sit back and say, I've been with XYZ, it's met all of my needs, I don't need to pay attention to any of this information.
That's right. There can be some substantial changes.
Okay.
And so the plan should notify you of those changes. Those notifications should be coming out now. And if it's something that you are concerned with, then this is a time review. See if it's still the best plan for you.
Okay. Also, our health changes. In the last year, we may have seen changes in our medication, anticipate more hospitalizations, and those are factors that can change your decisions about a plan?
Absolutely, because when first choosing a plan, your current situation, your health, your financial situation all go into determining, and the doctors that you're using all determine which plan is best for you. And all those things, as you point out, do change. I know there had been a Kaiser Family Foundation report that came out specifically addressing this, this re-examination of plans, and it mentioned a number of reasons why people don't want to make changes. Well, I think the main reason is the frustration of doing it because there are just so many options. And starting this time of year, you get bombarded with all of the plans saying, we're the best, you know, and it just confuses people. And they've made a decision and they say, I don't want to go through that again. That seems to be the primary reason why people don't do it. But it's interesting in that study, one of the things that, and it was a bunch of focus groups, one of them in Tampa. And people, when they looked for help, looked to friends, relatives, insurance agents, who else? But Shine or SHIP were never mentioned. And so that tells me that here's a resource that we're offering that perhaps if people knew more about, we can help you sort through that. It is complex.
And Janet, how is it that you help people to organize this process, to take away some of these frustrations or challenges that they don't want to expend the energy to go through this or to be confused to make a bad decision? What can a Shine counselor offer?
We try to help them sometimes by virtue of the insurance that they're coming from. Were they happy with that? Many employer plans have HMOs and PPOs now, it is a counseling session where we just take it to the basics. How much do you have to spend? That can decide whether you would go the route of original Medicare or a Medicare Advantage plan, perhaps right there. They might redecide it after we discussed for a while, but that is the initial. What plans do your doctors take, like Charles was saying? What drugs do you take? We're finding more and more that the plan decision for Medicare Advantage plans is being driven by the drug formularies more than it has in past years.
Okay, so that goes back to having this list of drugs, because you want, especially your expensive drugs, to be covered by the Part D plan.
Right.
Yes, and one of the things in the Kaiser study that people didn't change plans they tried, there is the Medicare website has a plan finder tool which allows you to compare plans, but people found it very confusing and difficult to use. Well, we've all been trained in that, and that's one of the things. We can either help you understand how to use it better, or we can do it for you and help you make the comparisons.
Okay. But I understand, Janet, you don't make decisions for people.
No. We have a lot of patience to help people and discuss the varieties and help them to make their own best decision. It is not anything that we do for them.
Okay, so you're helping them to make an informed decision, as opposed to just piling up everything that comes in the mail and the newspaper and being completely overwhelmed. You get them past that feeling of being overwhelmed to kind of determine what their needs are and get them to focus in on some of their options. Because a plan that might be good for you might not be good for Charles.
Right.
So you're very good listeners to listen to what a person's needs are.
And that's one of the things that it pointed out in this study, that frequently a couple, both spouses, will take the same plan because it's convenient.
Familiar.
But it may not be the best thing for them. And Medicare is for individuals, it's not for families.
And I think we've touched upon this before, that Medicare, people can get Medicare by turning age 65 or because they have received disability through Social Security for more than 2 years.
Right.
So SHINE helps people of all ages who are getting Medicare.
Yes, and also we will frequently talk with caregivers or others, children, spouses, whatever.
Okay. Are there other things that should be considered in selecting a plan? You've already mentioned the provider, that if you have a doctor that you want to stay with, and looking at their finances, you're looking at both the cost of the plan that they're considering as well as out-of-pocket costs. Do they have different out-of-pocket costs for some of the MAPDs?
Yes. All of the plans have co-pays for the services that you use, and all of the plans are slightly or more than slightly different, and they all have maximum out-of-pocket costs for the health side of the health care, and those currently can be anywhere from $3,200 to $6,700. And so you have to really make a decision based on what is important to you.
Okay, but you help them to see
And
what
we
those
help them
out-of-pocket
to do that,
costs
right.
can be. Would you encourage someone to start early in this process, not to wait until the end of enrollment period?
Yes, however, you still need to have the information available to do that, and it's not quite there yet.
Okay.
They're working on it, so we still need the 2015 plan information.
And that should be available by the beginning of
October.
enrollment period. So now is a time to start talking with their doctors to see what plans they accept if their
Make
doctors.
sure your drug list is up to date.
Very good. Thank you for giving us the thorough explanation about open enrollment period. We're going to take a short break, and when we return, we're going to talk about some of the other assistance that the SHINE can give to Medicare beneficiaries throughout the year, as well as the volunteer role in the SHINE program. So I hope you'll join us after the break.
Sarah is 64 and loves to garden, but recently her health insurance ran out, leaving her worried about more than just weeds. With pre-existing health conditions, Sarah's chances of finding good coverage were low. So she called the Elder Helpline and spoke with a Shine volunteer counselor. The Department of Elder Affairs Shine program provides free, unbiased counseling on health insurance for those on Medicare. More information is available about Shine or how you can volunteer at 1-800-963-5337.
During the first segment, we have been discussing the SHINE program that assists Medicare beneficiaries to make informed decisions about Medicare and other health insurance issues. Rejoining us for this segment is Charles Frankel, the local area coordinator, and Janet Mills, the SHINE area coordinator for both of our counties, Pinellas and Pasco. Let's talk, we focused during the first segment about the October into December period when people were making decisions about their next year's choices of their Medicare plans. Let's talk some about what SHINE counselors can provide all year round. Now is a time when people are hitting what's commonly known as a donut hole or the gap, where they have more expenses related to their prescription drugs. And can someone call a SHINE counselor and get some help?
Oh, absolutely. And that is, you know, sometimes it starts early in the year depending upon how expensive the drugs they're taking, but at some point their insurance will no longer cover at the same cost some of their drugs, especially the brand name drugs will go up considerably. And we will get calls. One of the things we look at first is whether or not they're eligible for one of the programs which is called Extra Help or Low Income Subsidy. And if your income is below a certain level, then this is a Medicare program. You are qualified by Social Security. We can help you fill out the information, the application online, very simple, takes about 10 minutes. If you qualify, it'll eliminate the gap, otherwise lower your copays, your cost if you're buying a drug plan. It's a wonderful help to many people.
Excellent.
And if you don't qualify for that, there may be some other manufacturers programs or discounts or ways we can help you lower your cost of drugs as well.
Very important, very important. And you mentioned the low-income subsidy. That's something you can help people with all year round, isn't it, Janet? That when someone calls and we screen them to see if their income is at a level that they might qualify for the low-income subsidy. And then also there is a Medicare Savings Program, which we call in Florida Medicaid Buy-In or SLIMBY, QUIMBY, QI1, or terms that we hear. What does that program do?
That program is called a Medicare Savings Program, and it pays the Medicare Part B and maybe more depending on which level of a Medicare Savings Program you're approved for. But that is a big help because currently, you know, people are paying over $100 for their Part B.
So people, and you know, the term low income is kind of a moving term. People, especially those who retired a number of years ago, may not consider themselves low income, but their income may be low enough to qualify for one of these programs, and then that in turn would free.
A large segment of the population here actually does qualify, and not all of them, or a large percentage of them, have not applied. And Jan, in the MSP programs, you also automatically get the help with the drugs if you qualify for that. And one thing that is an additional advantage, they only work with your drug plan, and if your drugs aren't covered, it doesn't help, but it gives you the ability to change plans during the year, so you can find one that will help. So that's also another benefit of qualifying for those.
So people who do not have the low-income subsidy or the Medicare Savings Program, when they make their decision during open enrollment, they're locked into that starting January 1st the next year.
Correct.
Through the full year. But persons in either of these programs, they can change?
They could change their plans every month if they wanted to.
Okay.
So if their drug formulary changes, like Charles said, and there was a different plan that covered that drug that was not covered under their current plan, they could move to that. They could move back to original Medicare. They could move to another Medicare Advantage plan. It is a great advantage that they have.
And that's a simple call to the 1-800-96-ELDER phone number. A SHINE counselor will call you back and they will discuss with you income. And it's a confidential conversation. And if one is potentially eligible, one of the counselors will assist with the application process. Let's talk some about people who are turning age 65. We keep hearing in the news how many people every minute are turning 65. We're in the midst of the baby boom generation hitting that magical age. And that's when a person, based on age, becomes eligible for Medicare. What are their options in terms of when should they be contacting the SHINE program, and what type of assistance can you provide to them?
Okay, very good. Well, they have a certain window when they can apply for Medicare, and certainly before you turn 65 is the time to contact a counselor to help you with your choices. You have options as to whether or not to take Medicare, and that is not always a clear-cut answer either. We can help you with that. It depends on whether you're employed, what parts of Medicare you could take, and whether it works with an employer plan. So that's one option. And then we can help discuss all your other options, staying with original Medicare, going to an Advantage plan, whether or not to get a drug plan, et cetera. But before you turn 65, please.
And that becomes increasingly important. It used to be 65 was the full retirement age, and now that has been pushed back to 66. So many people have in their mind, I don't need to contact a Social Security office or have a discussion until I turn 66.
That's another good point, too, because if you're already taking Social Security, you will be enrolled in Medicare.
Okay.
So you will find. If you are not taking Social Security, it's up to you to contact Medicare. They will not contact you. You will get a lot of information in the mail from all the companies trying to sell you plans, so they know you're 65.
Okay, so that's the wake-up call.
That's the wake-up call, but you are the one who will have to take the initiative to contact Social Security and enroll in Medicare.
Okay. Other assistance that you provide throughout the year to callers? What other types of calls do you get?
Oftentimes people have complaints about their plans, which we can try to help them resolve those. If they've contacted their plan without resolve, we help with bills that people disagree with, and we can try to clarify those or appeal those. That's very helpful part of our program.
It's interesting that, and we do need to discuss the role of volunteers in the program, but I have found a number of the counselors are people who have had problems with Medicare or were themselves overwhelmed with enrolling in Medicare when they were nearing 65, and they realized what a great help that the SHINE program was to them, and in turn they have decided to give back by being a volunteer. And I have to share with our audience, both of you are volunteers that give greatly to this program. In Pasco and Pinellas County, I understand you have almost 50 volunteers, and I looked up the number yesterday. Last year there were over 20,000 contacts with individuals that were made, and that would not be possible without having the committed volunteers who have the great knowledge and also the passion for this type of work. Who makes a good volunteer, Janet? What are you looking for in volunteers?
Well, it is a very special and very rewarding volunteer program. But people that are lifelong learners, people that love to solve problems, people that are very kind and have a lot of patience. And we are looking for people who really want to learn and give quality information as a result of that education. It is a process to become a SHINE volunteer. There is a basic training of 3 days, then there is a testing, then there is fingerprinting and HIPAA compliancy that we also agree to have. And then we have a 6 to 8 week mentoring process. So it is a process, and it is a very rewarding program for the right person. So I hope that you would consider becoming a SHINE volunteer if that is something that process is a match for you.
Yeah, as you can see, there is quite a bit of effort to train someone, so we do want people who would be committed. It does take some time and effort on the part of volunteers as well. And there's continuing education throughout the year.
Which is so important because just like now when different plans are coming out, it's a matter of all the volunteers becoming educated about the new options. I know in talking to new volunteers, as they go through this process, you can see the light bulb come on when they finally have gotten the information and they can independently work with a caller and assist them, and there's a feeling of achievement. But our counselors, they don't go through the class. You've mentioned that there's mentoring. There is assistance along the way, and there's the opportunity to work with other volunteers, so you're not out there alone trying to answer the questions.
And there are always resources, whether it's the internet. Yes, computer skills are very important.
Because so much of the information you acquire through the internet now, don't you? So that's important for our volunteers to have. I just always enjoy in our office seeing a group of SHINE volunteers going back and forth over, what a unique situation that they ran into, and then several people contributing to how that problem could be solved. It's
we now have our orientation process online, and people that want to learn more about SHINE and the process can go ahead and take the orientation class at floridashine.org. And that really gives you a good overview of what the program is all about.
And SHINE volunteers also go out into the community to talk about Medicare?
Yes, we will go to a business sometimes, especially if it's a large one and they have retirees. The human resources might want to have us come in and talk. We will go to almost any organization, an ALF or an institution or a school, anyone who would like to hear us. We're always anxious to spread the word.
So many people, when they are retiring, are concerned about keeping their minds active and bringing some of the skills that they had in the workplace, whether it's being out in the community or whether it's problem solving. This can be a good transition for them. And volunteers who are interested, what should they do? Give us a call?
Yes, they should call the Area Agency on Aging, the number of which I believe is being shown. And Sue Sampson is the program manager, and they need to speak with her.
Okay. Charles, what have you found to be most rewarding in your work with SHINE? You've been doing it for quite a while and have taken a leadership role with the program.
Well, it's really a combination of things. Just working with the people, that's probably the most satisfying thing, and because there is usually favorable feedback. And the learning, the problem solving, that's also kind of an interesting thing that keeps me active. So I enjoy that.
And for you, Janet?
I think the teamwork is really very rewarding. We're all very different people, but we're all working toward a common goal, and we always provide privacy, but we do talk about circumstances, and we learn from each other.
It is a wonderful team, and I hope anyone in our audience who is interested will give us a call to learn more about volunteering, as well as those in your audience who have Medicare questions. Please pick up your phone and call our helpline and make contact with the SHINE counselors to receive their free, unbiased assistance. I want to thank both of you for the important work you do and the time that you've taken today to share your information with our audience. And I thank you for joining us for the show today. I hope that you have found it informative.
You're watching PCC TV, Pinellas County Connection Television, a division of Pinellas County Communications.